Hey, good morning, everybody. This is Brittany Jennings coming to you from the Seniors Blue Book. And today we are on the segment of Doc Talks, and April's National Parkinson's Awareness Month. So I'm super excited to have Dr. Shivraman with Bluestone Physician Services. Good morning, Dr. Shivraman.
Hi, good morning.
How are you
Thank
today?
you for, I'm great. Thank you for inviting me. I love talking to people and explaining things. So I'm really happy to get the opportunity.
Awesome. Well, we always feel privileged when we are able to grab a few of our physicians and their teams moments to kind of give some education to those that watch. And we have a lot of active seniors and family members, caregivers, a lot of people that come to us for resources. And I thought it would be a great time during National Parkinson's Awareness Month to talk about fall prevention. As we know, and a lot of the professionals have seen this, is one fall can make a huge difference of where somebody's next steps are in their life. And so I thought it'd be a great topic to kind of shine some light on, be in front of, be proactive rather than reactive with a fall. So I'll kind of hand over the virtual microphone to you and let you take it from here on some tips and some information on fall prevention.
Okay, great. And, I was a hospitalist for 16 years. I mainly took care of patients who were in the hospital. And it is very, very true that a fall can really turn your life upside down and change you from independent to suddenly now needing assistance forever. Of course, that doesn't happen every time with every person, but for people who are over 65, 1 in every 3 people have a fall every year. So that's a lot of people over the age of 65. And of course, as you get older and look at other medical problems that those individuals may have, they may go from living in their own house to not being able to live in their own house anymore. So let's talk about prevention first. So one of the best things to kind of live by is use it or lose it. So it's very, very important that even though you may be achy, even though you may be feeling fatigued, go to your doctor, work out a plan where you can look through your medications and see what may be contributing to your fatigue and tiredness. It could be depression. It could be not getting enough sunlight. So I think that keeping active is the number one thing that you can do for fall prevention. Keeping active, doing little exercises that help you maintain or grow your ability to balance. Make a point not to, if you can, not to sit down and put on your pants. If you can, when you're dressing yourself, do it from a standing position. And if you're not there yet, that's a goal that we need to keep in focus, because if you don't use it, you lose it. So my mother-in-law, a real source of a lot of inspiration, she does an exercise every day where she lifts one leg and makes little circles with that lifted leg without holding on to anything. Maybe on day 1 through 7, she had to hold the wall and do that, but she doesn't do that anymore. So little exercises to help you keep your balance, trying to be as active as possible. Check your eyes and check your hearing. regularly, because if you have these visual problems, or you're not hearing things very clearly, and we sometimes are in denial because we learn to live with those problems, but getting your eyes checked and your hearing checked, that will help you even in falls. Again, talking to your doctor about whether any of your medicines may be causing side effects. You know, many people have hypertension, and they get medications for hypertension, or they get medications for prostate problem, and they don't realize at that time that when they stand up, it takes a longer time for blood to overcome gravity and go to the brain, because they're taking medicine that intentionally is relaxing their blood vessels so that blood doesn't rush up as quickly. So it's, if you're taking these kind of medications, it's important that you stand up slowly and you wait. You kind of have to take a little time to wait to change positions, because there's some amount of dizziness that may be required in order for you to keep your blood pressure normal in other circumstances. Many times I found people who came into the hospital and they were having difficulty sleeping, so they were taking medicine prescribed by their doctor for sleep. As we get older, our livers and our liver and our kidney may not process that medication and get it out of our system as quickly, naturally, as it would in a 20-year-old, a 30-year-old. So though that lorazepam or that Ativan might be lingering in your system, even building up in your fat cells before it is completely metabolized. So what that means is there may be other things that will help you to sleep better, like sleep hygiene, not watching TV while you're in bed, using your bed only for sleep, or reading a book before bed. That's always quick to put me to sleep. So that I think is really important, to know what you're taking and why you're taking it and what the side effects can be. I think that it's our responsibility after a certain age to kind of push our patients away from these kind of medications that can cause drowsiness or contribute to falling, because we really know how much that can change a person's living arrangement and living style and lifestyle and independence with just one broken hip. So that said, I wanted to talk about the side effects of medications. It's very important to sleep enough so that you're not drowsy during the daytime. If you find yourself really kind of tired all day long and you feel like you're having difficulty sleeping, then before getting a medicine for that, there are other things to check. For a gentleman over 65, it could be his bladder keeping him awake at night, needing to get up and go have to pee a few times. There are medications for that. For an issue with the prostate that's keeping you up at night. So it's always good to go see your doctor before taking a Tylenol PM or something like that. So we talked about staying active. We talked about the side effects of medications. We talked about getting enough sleep and reducing medications that make you drowsy or off your game. We talked about eyesight. We talked about hearing. And if you need it, you may need an assistive device, maybe for just part of the day, maybe for the times of the day you're more tired, with a cane or a walker. But these devices are designed to help you stay independent, although we may feel our ego will not allow us to resort to them. The point is keeping your independence for as long as you can. Okay, keep your bones strong. Keep your bones strong with calcium, vitamin D, and none of that's going to work without sunshine. So you need to get out into the morning sun for at least half an hour for that vitamin D that you take for that to work. Okay. Do as much as you can to try and quit smoking and quit alcohol, or reduce your consumption of these things, because they can even influence your balance. And lastly, you can fall-proof your house if you think you might have the tendency towards falls. You can fall-proof your house by removing carpets with edges that can shift or that you can trip over, by having grab bars within reach in the bathroom, by doing what you can to make sure that your floors are not wet and slippery. And if it may mean, changing some things around the house, but if it keeps you in that house, then it's definitely going to be worth it.
I think it's a great point that you bring up home safety, because I know a lot of times, you guys are doing visits, let's say at assisted living communities even, and you can recognize that it may not be the best or safest setup. And so you can recommend something like home health or therapy to come in and kind of rearrange and make sure they have the right grab bars in place, or they have the right assisted device and that it's the right height for them, and those sort of things that can really help prevent a fall.
Excellent. Yeah, I really, really believe in physical therapy. If I could qualify and get someone to come home and make me more balanced and more steady, I would do it. So if it's offered, take it, because these people, they know what they're doing. They've seen it a million times. They really want to help. Now, God forbid, what if you fall? If you fall, what do you do? So the first thing to do is, you've fallen, just be calm, breathe slowly. There will be help, and don't try to jump up right away. So the first thing to do is to calm down. The second thing to do is to see whether you're in a position to be able to get up. Okay, if you can, then just roll onto your front, put your hands down, try to get on your hands and knees, gently crawl over to a chair, if a chair is nearby. Holding onto the chair, you put one knee up and get yourself up to a seated position. And then if you can, wait for help. I'm a big advocate for the alert buttons that you can wear around your neck, or have in your pocket, or have on your keychain, because it's always within reach. Then if you fall and you do need help, you can just press that button and help will arrive. If you feel you cannot make it to a chair or move, then all the more reason to have a Medi-Alert type system within easy reach, so that you can, call for help and get it as fast as possible. But being calm is the best thing you can do for yourself in almost every situation. Just if you're feeling really anxious, just start with the breathing. Focus on your breathing. Breathe slowly. and help will.
One question I have for you that people may have is, when I used to work in senior living communities and there was a fall and the potential that somebody's hit their head, okay, whether that was a parent because of the scene or because it wasn't, but they thought they may have bumped their head, what would you recommend in that situation? Is that the moment that you would call 911 for help, or how can we help people kind of answer that question?
Yeah, absolutely. I think if you're worried that you've hurt your head or your neck, the best thing to do is just be still. You know, if you're lying on your back, when you fall, just wait for help, calm down. You can make little movements to see if you're okay. If it's not hurting you, then just move slow, go slowly. It's important, if somebody has fallen and you're going to help them, don't get them up on their feet right away. Go slow. Make sure that they have not hurt their neck. Usually when EMS comes, if somebody has fallen, whether they need it or not, they put a C-collar on them to immobilize their neck, to kind of hold everything where it's supposed to be. And then they'll get them up on the stretcher and then they'll take them to the hospital. So slow and steady is how to do it.
Doctor, I just want to say thank you so much for your time today. And if anybody would like to learn more about Bluestone Physician Services, I'll have the number at the bottom of the screen right here so that people can reach out.
Thank you for the opportunity. Like I said, I love talking to people, teaching people, and explaining things if there is any confusion about why we're doing what we're doing or how we're trying to help.